I've had over 43 years in the career path of nurse in some form or fashion. I've been a wound care specialist for at least 23 of those years. And I've worked acute care, I've worked primary care. I've been a family nurse practitioner for probably 13 years now, but I was a clinical nurse specialist before that, which is more inpatient focused. So I've seen a lot of people go through a lot of procedures and suffer a lot. And the primary modality has always been medication, and it's been opioids, it's been all of those sorts of drugs that we now are trying to get away from. And in fact, the last year of my practice has been in addiction medicine. So in that regard, I've seen the abject suffering that happens when people become addicted to these drugs, and after a fashion, they don't work anymore. In fact, it's counterproductive and they don't get the relief, but then they're dependent on the drug. My mother was a military, an Army nurse before they really even had Army nurses back in World War II. She did Army transport. So when my mom had told me all the stories about going to Germany and transporting troops and taking care of them, and they used to give her their patches. She had a whole pillowcase full of patches from China, Burma, India, and all the different units. And I thought, wow. And there's a story with each one of those. After learning about what she had done to help other people through her service, that was something I wanted to experience for myself. And I have to say, I don't regret it for a minute. I'd do it again. It's just priceless. When I was in the VA working there for 15 years, and as a nurse, you do a lot of repetitive tasks with your hands, especially as a wound care specialist. I'm doing debridements, I'm doing a lot of manipulation, compression wrapping, I'm looking at a lot of hands-on activity, not to mention all the endless typing that we have to do to record and document our visits. I developed carpal tunnel syndrome. Well, I developed it in both hands. I had surgery on the right, and that went well. It resolved, pain went away in about 6 or 7 weeks, but not the second one. And that's when I got into trouble. And that's when I had just driving pain. It was almost like somebody putting a railroad spike down the middle of my wrist. It was horrible. And we couldn't figure out why that was doing that. I couldn't sleep well. It was waking me up. And there was no explanation for it at the time. And I had, to be honest with you, I'd been at the end of my rope in terms of I wasn't going to be able to take opioids, didn't want them, and I needed to work. So what was I going to do? Well, my days are long, and there was a great need to reach out and find something that would work. And so I had dialogue with your company as a provider, as a professional at the VA, because we have a number of people with chronic pain there, of course, and acute post-operative pain, like from amputations and such. And I had heard about the Provant system. And to be honest with you, I see myself as an evidence-based driven provider. I try and go by the research, and there wasn't a lot out there at the time for Provant. And to be honest with you, I was quite the skeptic, and I really didn't embrace it as a general use modality. I was going to wait for more research to be done, but I was desperate for finding some way to deal with this pain. So I started using the therapy, and at first I didn't really notice any marked difference, but over time the pain became less intense, and after a period of weeks, I don't recall exactly how many, but it was probably a couple, 3 anyway, it was noticeable, and eventually it resolved and did not return. Only thing I can pin it to is the system, because I had tried everything else There were no other interventions that I tried for pain relief at that time. So when I was invited to speak to the FDA about my experiences with the technology, I described the course of my treatment, that nothing else had really proven effective, and that I found relief with it that I otherwise had not been able to achieve. My experience as a patient is say, yeah, look at this, because you may need less of the oral or IV pain medication. You may benefit from this. Please consider trying it, because it could save you the side effects and the trauma of severe pain. And I have to say, I recommend it when people come to me with a story of intractable pain, and saying, if you can work it out, to consider it. I think that we need to definitely look at more modalities that help preclude the use of opioids. I've done a recent year in addiction medicine, and I can't tell you the kind of abject suffering people go through is just mind-boggling. And to watch people try and get loose off of the addiction of opioids is heartbreaking, to be quite honest. What we don't know, what we haven't experienced, it's basically nothing we're going to consider until somebody points it out and say, hey, this is an option, maybe you didn't think about it. Which is why I'm here today, which is why I'm talking to you today, because I believe that people need to have options. They need to be able to make informed choices. And the only way that that's going to happen is if we share information.